I'm Nikki Thaut, the Chief Radiation Therapist at Willamette Valley Cancer Institute and Research Center. Radiation therapy is a very unique area of medicine. It's one of those great areas where we get the best of all worlds, I feel personally. I get to work with patients in their journey. I get to be a part of a team. I get to work with really amazing technology. Oncology care is so complex, and every patient's situation is very different. And they require and really deserve to have all of those resources under one roof for themselves to make sure that their journey is as smooth and as successful as possible.
People like Nikki just really live the idea of patient-centered care. Friendly, professional, competent, warm, supportive, and those are the kind of things you really are looking for when you're a patient. She is a gem. She's a real gem, yeah. It's
not easy work, but life isn't easy, and it's an honor to be a part of someone's journey when they're going through cancer treatment, and I'm here for the patient to take care of them and their family. Oh my goodness, this is an amazing time to be a part of oncology, and so hopeful because there's changes happening every single day. But that in itself provides hope, and is an amazing time to be able to share with patients and family of what we do right here in Eugene.
My name is Charles Anderson. I'm a gynecologic oncologist at Willamette Valley Cancer Institute. About 4 or 5 years ago, we began opening clinical trials in gynecologic cancers, and we're geared towards primarily ovarian cancer. And that began to kind of build upon itself, and we became more, intricately involved with research at a national level. But with that success came more opportunity in other types of cancer besides ovarian. We're now opening clinical trials in cervical cancer. We have other trials in endometrial cancer. In the last 10 to 15 years, gynecologic cancers have changed a lot in terms of how successful we've been, and a lot of them are much more treatable than they ever were. To know that one or two patients, even when a trial doesn't succeed for the masses, it can still impact certain patients positively. And sometimes you get profound results, and I have several patients that were in that category at this point that have not recurred. Their disease is completely stable or gone. That's like super hopeful.
He's marvelous. He really does care about his patients, and he's told me what to expect, and he hasn't been wrong. I wouldn't have been alive today if it weren't for this place and the treatment I got.
I think a lot of this job is not medicine in terms of giving people drugs or operating on them. It's actually taking care of them and their families on a personal level. If I can give them that, it does comfort them to some level, and I feel like that's a very important part of my role as an oncologist.
I'm Dr. Merideth Wendland. I'm a radiation oncologist at Willamette Valley Cancer Institute. I think it's a very hopeful time to be in oncology. There's lots of research trials out there, great treatments on the horizon. I think we can help a lot more people than we used to be able to. With radiation, we are much more precise at being able to target tumor cells. It allows us to treat smaller areas, less normal tissue, fewer side effects. Radiation, I think, is pretty scary for most people. There's a lot of unknowns, so I think it's important to really take the time to spend with people so they understand what is happening to them.
This is an overwhelming diagnosis for anybody, and Dr. Wendland has an ability to be able to sit a patient down and calm them through the entire process, explain what we're going to do, and give the patient a sense of control and hope. It's what a patient needs when they come in here, is that type of a provider and that type of a team. One that's not just looking at a problem to be solved, but as a person to be healed.
I try to treat folks how I would want a family member treated, and that often means taking those extra minutes. If people can leave less fearful than they came in, then I've done